Events of the last 7 months are a tragic reminder of the insecurity and instability that disease can cause. The COVID-19 pandemic has changed our world. It has stress-tested our political, economic, cultural, and social infrastructure and found us wanting. It has pushed the limits of health systems, both weak and strong, leaving no country untouched. It has humbled us all. The world spends billions every year preparing for potential terrorist attacks, but we have learned lessons the hard way that unless we invest in pandemic preparedness and the climate crisis, we leave ourselves open to enormous harm. Since WHO was created over 7 decades ago, we have worked to galvanize collective international public health action to build a healthier and safer future for humanity, from ending smallpox to bringing polio to the brink of eradication, from rolling out treatment for HIV, TB, and malaria to millions of people across the world, to responding to hundreds of emergencies. Building up all health systems and ensuring health for all is our best shot at delivering on the goal of the global health security. 15 years ago, the global community came together and adopted the international health regulations in 2005. Its implementation by 196 state parties was a major step in the coordination of international action to enhance global health security. Following WHO being notified of an atypical strain of pneumonia circulating in Wuhan province, China, the IHR, the International Health Regulation, was triggered and the world was subsequently informed of the outbreak in early January. The genome was mapped within the first week of January, and in the second week of January it was publicly shared and WHO published how to build a PCR test for COVID-19 from our partner lab in Germany. In the third week, WHO identified and began contracting for validated production of quality PCR tests. And by the first week of February, WHO began shipping tests to over 150 labs around the world, which enabled the world to track and trace the virus around the world quickly. And it was under the IHR, the International Health Regulation, that WHO declared a public health emergency of international concern on 30th January, WHO's highest health security alert under international law. At that time, there were fewer than 100 cases and no deaths outside of China. Today, more than 18.5 million cases of COVID-19 have been reported to WHO, and 700,000 lives have been lost. No country has been spared. Low, middle, and high-income countries have all been hit hard. The Americas remain the current epicenter of the virus and have been particularly hit hard. Just 3 countries have reported over half of all cases. No single country can fight this virus alone. Its existence anywhere puts lives and livelihoods at risk everywhere. It's never too late to turn outbreaks around, and many countries have done just that. So it's never too late to turn the situation around. Our best way forward is to stick with science, solutions, and solidarity, and together we can overcome this pandemic. COVID-19 has also exposed how misinformation poses one of the greatest security threats of our time. Misinformation can spread faster than the virus itself. Since the beginning of this pandemic, WHO has been working to address misinformation. We have worked with all major tech companies to counter myths and rumors with reliable evidence-based advice. Last month, WHO brought experts together from across the world to hold the first conference on how best to tackle the COVID-19 epidemic. Through our daily situation reports and regular media engagements, WHO offices have kept the world informed. Fewer than 100 cases and no deaths outside of China. Today, More than 18.5 million cases of COVID-19 have been reported to WHO, and 700,000 lives have been lost. No country has been spared. Low, middle, and high-income countries have all been hit hard. The Americas remain the current epicenter of the virus and have been particularly hit hard. Just 3 countries have reported over half of all cases. No single country can fight this virus alone. Its existence anywhere puts lives and livelihoods at risk everywhere. It's never too late to turn outbreaks around, and many countries have done just that. So it's never too late to turn the situation around. Our best way forward is to stick with science, solutions, and solidarity, and together we can overcome this pandemic. COVID-19 has also exposed how misinformation poses one of the greatest security threats of our time. Misinformation can spread faster than the virus itself. Since the beginning of this pandemic, WHO has been working to address misinformation. We have worked with all major tech companies to counter myths and rumors with reliable evidence-based advice. Last month, WHO brought experts together from across the world to hold the first conference on how best to tackle the COVID-19 infodemic. Through our daily situation reports and regular media engagements, WHO offices have kept the world informed.
This is Mike Ryan. No, I think what we have to be focused on is, yes, accelerating the development of the vaccine, and a lot of people in the US and in many countries around the world are doing tremendous scientific work to accelerate the development of the vaccine. And I think with over nearly 140 vaccines at some stage of development, 26 in clinical trials and 6 in phase 3 trials, that's an incredible outcome for a very few short months of work. What we need to do now is ensure that that vaccine is safe and efficacious. The studies are underway, 6 phase 3 trials, beginning with larger numbers of patients. And as that work continues, we have to continue to watch out for the safety and for the clinical efficacy signals. Should we find that signal, we should be able to move into production of that vaccine and begin to use it in human populations. But we will still have to remain cautious as we scale up the number of people vaccinated. Rare side effects are rare, and they only become apparent when you vaccinate lots and lots of people. So there will still be a need for a monitoring phase, even when we start to vaccinate at population level. There are no cutting corners here. I think many experts in the States, the head of NIH, Tony Fauci, and others have spoken. This is about accelerating the process of development, putting the risk in financial side of the equation, not on the safety side of the equation, and ensuring that there's enough production to meet the needs around the world. And that is the key issue. Are we going to have enough vaccine for everybody who needs that vaccine around the world?
I'm curious to get your thoughts about this notion of human challenge, of purposely exposing people in the trial to the active virus, the ethical concerns about that. What are your thoughts, Dr. Tedros?
I can begin. Tedros can follow up. The human challenge, we've had a group looking at human challenge studies. Certainly, for those of you out there who don't know these things, this is where you would potentially intentionally expose a person who's been vaccinated to the virus in order to see if the vaccine works. On the face of it, one would never attempt that with an extremely dangerous virus. In this case, young healthy adults don't tend to get very sick, and there could be a justification for that in certain circumstances. This is usually done when there's very low level of human disease, and therefore it's difficult to demonstrate efficacy. In this case, we have disease all over the world. We should be able to demonstrate efficacy of the vaccine in the traditional way by large-scale population-based trials. But we've had a committee looking at this. We have laid out the parameters for when and where and how this could be done. Obviously, We do not fully understand the long-term consequences of natural infection, even in younger adults, and we will have to think and be very, very careful before instituting human challenge studies. They will have to be very carefully assessed for their ethics and their potential health effects. But there are circumstances, certainly, in which such trials can be justified with the appropriate ethical oversight.
So that's a good question as well. I mean, I think when people use the word lockdown, that means different things to different groups. Many people we don't actually use that word lockdown because it's actually composed of several different types of interventions that are used. There are restrictions, stay-at-home restrictions that some countries have used. There are movement restrictions that some countries have used, physical distancing, hand hygiene, the whole package. And I think what the Director General has said and what we've tried to say from the beginning is that it isn't one action. It's actions of individuals, it's actions of communities, and we do see that these measures work. What we are seeing is that what we're hopeful for is that we will not have to, or countries will not have to impose any of these so-called large lockdown measures again. That actions can be tailored and they can be geographically limited to where you have the most intense transmission. They can be time limited to help countries activate their public health systems to find cases, isolate cases, care for cases, carry out contact tracing, make sure that testing is available, and make sure that communities are engaged, empowered, listened to, and are part of this fight.